So good morning and welcome. We are so happy that you took the time to join us for this presentation. We at Newborn Screening are so proud of this latest initiative. Screening for biliary atresia is completely different than anything else we do at NSO, and it is truly a collaborative endeavor. So I'm Robin Kirkwood. I'm a registered nurse with a nursing career spanning over 30 years with a focus on newborn medicine, NICU, L&D, both in the frontline and educator roles. I came to NSO about 6 years ago to work on the development and implementation of critical congenital heart disease screening. And now I'm working with the BA implementation team. So we are very fortunate in Ontario to have such a robust newborn screening program. It is far-reaching, including Ontario, Nunavut, and also Newfoundland. We screen for over 30 diseases. The NSO lab at CHIO in Ottawa tests the dried blood spots, and reporting of these results comes out of NSO. And we, as I mentioned before, oversee CCHD screening in the province, and also risk factor hearing screening, so congenital CMV testing, and now soon to launch in Ontario in-home biliary atresia screening. Okay, so just to give you an overview of this session, our first speaker will be Dr. Erica Bariziak. She is an academic neonatologist at CHIO as well as the Ottawa Hospital. She is also an associate professor, Faculty of Medicine at the University of Ottawa. Erica is a valuable member of our CCHD screening working group, and now we are grateful to have her as the medical lead of biliary atresia screening at Newborn Screening Ontario. She will present information about biliary atresia and the screening process. Our second speaker will be Phil Moran. He is the BA project coordinator at NSO, looking after many aspects of the workflow, internal processes, and much, much more. Previously, he led the track kit implementation for Newborn Screening Ontario for the samples across the province, and he is currently finishing his master's in public health with a bachelor's degree in biochemistry. So he will speak about how you can help families screen, supportive resources available, card distribution, and we'll facilitate questions at the end of the presentation. So just one final thing, our apologies if you're having lunch right now, but be aware this is a talk about poop screening. So just so you know. So at this point, I will turn it over to Erica. Next slide, please, Phil, and enjoy the presentation. Thank you.
Super. Thank you, Robin. And thanks everybody for joining us today to learn about the important role you'll play in helping us to further improve the outcomes of Ontario babies. And so, as you saw on our outline slide, we're going to start by talking about biliary atresia as an overview, how it's diagnosed and treated. So it's a uniquely pediatric liver disease that's caused by a progressive and complete obliteration of the bile ducts that normally drain bile from the liver into the intestines. And so bile, being a digestive enzyme that helps to emulsify fats and help with digestion of food, then accumulates in the liver. It causes inflammation and scarring and damage of the liver. And this can lead to what is the most frequent cause of pediatric liver transplant and the most frequent liver-related reason for death in children. And in Ontario, this amounts to just over 1 in 16,000 babies, which is a little bit more frequent than what we're seeing in Canada. And so it's important for us to have a screening program for biliary atresia because these babies are born healthy. They don't have symptoms right away for the most part. And symptoms related to the biliary atresia itself appear around 2 weeks of life. In the early stages, it's persistence of jaundice, and unlike the physiologic jaundice, which is unconjugated, this is a conjugated or a direct hyperbilirubinemia. Their urine can appear dark and they can develop pale stools. And it's important to help you understand why that happens. As we know, bile is a dark green liquid, and in the normal situation, it gets into the intestine and it gets incorporated into the stool, and it's what gives the stool the pigment. And throughout the digestive process, as it breaks down, it takes on various shades of green, brown, or yellow. If we're not getting that bile into the intestine and into the stool, we don't have pigmentation in the stool, and stool is pale. So this is an early finding. If biliary atresia is not diagnosed, late findings include abdominal distension, and that's due to ascites or hepatosplenomegaly. The babies can have weight loss because of fat and nutrient malabsorption, and they can even go on to have GI bleeding. And so the treatment for this is really to reestablish that flow of bile out of the liver. It can only be done surgically, and it's done through a procedure called the Kasai hepatoportoenterostomy, or a Kasai procedure. And this was developed in Japan by Dr. Morio Kasai in the late 1950s, but not incorporated into the Western world until the 70s as a realistic operation to be able to deal with this problem. And as you can see on the diagram there, it's a segment of intestine that used to be able to take that bile, and it's actually brought up into the area where that atretic or fibrosed bile duct used to be, and then it's reattached to the intestine again to help drain the bile out. And so the timing of this Kasai procedure is key. And without the Kasai, children with biliary atresia will rarely survive beyond 2 years of age without needing a liver transplant. And without the surgical repair or a transplant, liver failure and mortality will ensue. And so performing the Kasai early is essential, and it's best achieved if done within the first 30 days of life. So we have best outcomes for native liver survival, as well as delaying the possibility of needing a transplant if done in that first month of life. And so how are we doing in Ontario right now without a screening program in diagnosing and treating biliary atresia? Well, there is room for improvement. So in Ontario, the median age of diagnosis is 62 days. The median age of performing that operative procedure to drain the bile, the Kasai procedure, is 66 days. And unfortunately, almost 20% of babies in Ontario don't receive this treatment until over 3 months of age, with only 25% receiving that Kasai procedure in a target time frame. And in Canada, this is very similar. So only 8% of the babies in Canada will get their Kasai procedure in under a month of age. And this is an international problem. Biliary atresia is worldwide, and worldwide we're struggling with ways to get this bile out of there before it destroys the liver. And so this can be related to some system challenges with diagnosing this in newborn infants. The first of which is that jaundice is very common in newborn infants. Up to 60% of term babies will have jaundice, and up to 80% of preterm babies will have jaundice. Breast milk jaundice can last easily into the second week of life, and it's often thought to be physiologic and not harmful. But there's a lack of awareness among some parents and some healthcare providers that jaundice lasting more than 2 weeks of age or pale stool can indicate liver disease and needs to be investigated. Also, our well baby care schedule in Ontario sees that most well babies will not have a scheduled visit with their healthcare provider between that 2-week and 2-month window. And that's when both the babies are presenting with their early findings, as well as when we need to intervene to have best outcomes. And so, currently we're not set up to pick this up early. And so for these reasons, Newborn Screening Ontario is very proud to be implementing screening for biliary atresia. We're going to be welcoming families and caregivers into the screening role for the first time using an infant stool color card. And this tool is simple, it's non-invasive, it's very cost-effective, and it allows families to monitor their baby's stools daily for the first month of life at home. And this will lead to earlier diagnosis and treatment and result in better outcomes for our babies in the province. And we're not the only ones doing this. It's been used around the world, and infant stool color cards screening for biliary atresia works. For over 2 decades, it's been used in Japan and Taiwan. And even in Canada, British Columbia started using an infant stool color card for screening 8 years ago. It's used in several countries throughout Europe, in parts of Africa and South America. And in Taiwan, which is one of the longest standing programs and one of the most published programs, they have not seen any cases of biliary atresia where a Kasai was performed greater than 90 days of age. And their 5-year survival post-Kasai of the native liver in those children has almost doubled since using the infant stool color card for newborn screening. And so this is a photo of the card that we'll be using in Ontario. It's double-sided. It is a printed reference that will be distributed at the time of a baby's birth. And the front has multiple stool photos, the top 6 being abnormal stool and the bottom 3 being normal. On the front, there are also instructions on how to contact newborn screening. And on the back, we have information for the families about what is biliary atresia and why it's important to screen and what they should do and what to expect next if their baby does have pale stools. And it's very simple. We ask them to keep it at their bedside, at the baby's bedside or at the change table, and compare their baby's stool to the colors on the card for the first month of life. If they notice a stool color that corresponds with the abnormally colored stools on the card, it directs them how to contact Newborn Screening Ontario. And so our contact methods are a dedicated phone line, 1833-POOP-CHECK. We also have a dedicated email address and a website with a web portal that can be accessed through a QR code that is on the infant stool color card. The web portal will allow families to enter their contact information as well as upload stool photos for our team to assess. Whenever a family doesn't speak English or French, we will leverage CHEO's voice translation services to help us in our communications with those families. And once a family reaches out, NSO will contact that family within 1 business day and perform a telephone assessment to ensure that both with information that we get from the stool photos as well as information they give us, this is truly a pale stool that requires next steps, and then we'll arrange those next steps. And so a screen positive for this program is acolic or pale stools. And that is identified through the parent report, as well as the telephone triage assessment by our NSO healthcare provider. And then confirmation that this pale stool is due to cholestasis is through a measurement of direct or conjugated bilirubin level. And so Newborn Screening Ontario will refer the family to a gastroenterologist or hepatologist at the nearest pediatric academic health science center. And that hepatologist or gastroenterologist will contact the family, arrange that for that blood work to be done remotely. They'll interpret it, and then they'll move on with next steps. And so a bit more on that diagnostic workup. So as I just said, the confirmation of cholestasis being the cause of that pale stool is the bilirubin level, the conjugated or direct. But that just tells us that there's a blockage of bile flow. It doesn't tell us why. And so to determine whether this is from biliary atresia, a further diagnostic workup has to ensue, and that would involve blood tests and liver imaging. And although biliary atresia is the leading cause of cholestasis in newborns, this screening program will also pick up other causes that are treatable that would be important to know as well. So urinary tract infections and sepsis can cause this, some inborn errors of metabolism, panhypopituitarism, obstructive gallstones, or cysts within the biliary tree, and bile acid synthesis defects will also be picked up through this. And so this is a summary of the screening workflow. Again, the infant stool color card will be distributed by birthing centers, midwifery practices to families and parents. They'll take this card home and do in-home screening of their baby's stool for the first month of life. If they have concerns about their baby's stool color being pale, they will contact Newborn Screening via the card instructions, and Newborn Screening will perform a telephone triage of that case. If deemed appropriate, that family will be referred by Newborn Screening to a gastroenterologist or hepatologist at an academic health science center, where arrangement will be made for a remote or an outpatient direct or conjugated bilirubin measurement. They will then interpret that with the family, and if it meets our cutoff threshold, they will then bring the family in for ongoing workup and treatment if needed. And so screening for biliary atresia doesn't just apply to those babies who spend their first month at home. We want all babies to have their stools screened. And so for babies admitted to hospital in that first month of life, we would ask that you keep an infant stool color card at the bedside and help to screen the stools at diaper changes with the families. We would also ask that you notify Newborn Screening if an admitted baby has a pale or acolic stool. And premature babies are a special group of patients because they're at a higher risk of developing biliary atresia, and they can also present with symptoms later. And so we are recommending that babies who are born under 37 weeks gestation have their stools screened, or they're instructed to screen at home for 4 weeks beyond the baby's due date. So just to clarify that, if you have a baby that's born at 36 weeks, we would ask that the stool be screened for 4 more weeks to take them up to the 40-week due date. And then we're going to screen for another 4 weeks past that due date, so 8 weeks total for that prem baby. And so we need to make sure that families have an infant stool color card to continue screening at the time of discharge if they're being discharged during that window. We hope that this isn't common, but some families may elect to go see their primary care practitioner. So this could be in the community office, the emergency department, a community GI clinic, or a walk-in clinic, rather than calling newborn screening. And so we ask that if they do that, they bring the card with them. And we ask you as the primary care providers to notify us if you also believe that the stool is pale. And this is important because notifying newborn screening is the fastest way to get this referral to gastroenterology for the bilirubin measurement and interpretation. And it'll also help NSO to track the screen positive cases and to monitor the effectiveness of our program. And so this really underscores the importance of a collaborative approach to the biliary screening that involves key players in the home, the community, and the hospital environment. And through our planning and development of the program, we were very grateful to have the extensive input of individuals from each of these levels. And, so I thank all of our extended team across the province for helping us get to where we are with the program. And so at this point, I'm going to pass things over to Phil, and he's going to talk about how you can help families to screen.
Thank you, Dr. Biliary, for a great presentation. So how can you help families screen for biliary atresia? Very simply, we're asking you to ensure that an infant stool color card be provided for every newborn in Ontario. It will also be very important to briefly educate families on how they can use the ISCC to screen and why it is so important to screen for the first month of life. To help you, we've produced a script for biliary atresia screening that outlines all of the key messages. We've also produced a modified script with some specifics around infants that are admitted to hospital and or born prematurely at less than 37 weeks. If families find stool that is abnormal in color, it is important for them to contact our team using one of the methods listed on the infant stool color card. And regardless of how they choose to contact us, we will be in touch with them within 1 business day to conduct this telephone assessment. We will make available a variety of resources on our website. Any materials that is directed to families will be available both in French and English. We've also translated the written content of the infant stool color card in over 30 languages. These translations will be available to download from our website. However, it is very important that translations be used in addition to the original printed copy of the infant stool color card. This is to ensure the same color accuracy across the board, since colors may appear different depending on the printer or monitor that is used to display the translated copy. On our Biliary Atresia website screening portal, you can expect to find more information about the disease, a video instructing parents on how they can screen for biliary atresia at home, frequently asked questions for both parents and healthcare providers, and more materials for parents and healthcare providers as well. We are also making available a web form that parents can use to contact us if they believe to have detected pale stool. There, they will be able to indicate their concern and upload up to 2 images, if possible for them, for our team to help them with the assessment. So how can you get your hands on some infant stool color cards? Around mid-November, NSO will package launch kits for all newborn screening submitting organizations like yourselves, be it midwifery practices or birthing hospitals. Unless you specified otherwise, these launch kits will be sent either to your office if you're a midwifery practice, and they will be addressed to the maternal newborn manager or educator at your hospital. You can expect to receive a 3 to 6 month supply of infant stool color cards in this package, along with posters, a frontline script for BA screening, screening key messages, and instructions on how you can order more cards. Like the dried blood spot collection cards, the infant stool color cards are free of charge. There are 25 of them per package, and they are the same size as the blood spot collection card. They will be distributed using the same distributor as the dried blood spot collection card, and we will be asking that you order infant stool color cards every time you order dried blood spot collection cards. However, we are encouraging that you keep more of these in stock to distribute to families who may be looking for some additional copies, whatever the reason may be. It is therefore important that when you place an order for dried blood spot collection cards, that you also specify you would like to order an equivalent or higher number of infant stool color cards. So let's recap this presentation with an important key message. 1, families are asked to screen their baby's stool for 1 month after birth using the infant stool color card that is distributed to them. And 2, families should call NSO with any concerns regarding their baby's stool color. For more information about NSO and biliary atresia screening in Ontario, please visit our website. We're updating content regularly ahead of this launch, and feel free to also send our team an email if you have any questions. Thank you very much for attending this presentation today, and most importantly, for your frontline contribution to newborn screening in Ontario.